do we see in terms of clinical signs in cats with kidney disease? Well, we've already said these clinical signs are not going to develop until at least 3/4 of normal kidney tissue has been lost. When cats do develop clinical signs, the most common clinical signs we see are actually very vague and non-specific. Things like lethargy. The cat's just sleeping more than usual. It's not as active as it usually is. Inappetence, loss of appetite, and some loss of body weight. And those are clinical signs that are often mistaken simply for a cat that is getting old. Many people don't equate that with a disease, they just think it's old age with their cat, not realizing that perhaps there is a specific disease that can be identified and managed. As kidney disease progresses, and as the disease gets worse over time, so we tend to see other clinical signs developing. Other signs that may be a little bit more specific for chronic kidney disease. So as the disease progresses, cats lose the ability to concentrate their urine. That means they urinate more. So they produce a larger volume of urine, and to compensate for this, they will have increased thirst, so they will drink more. As the disease progresses, cats may develop intermittent vomiting or nausea, and that may contribute to the inappetence. There is a window of opportunity for earlier diagnosis. Diagnosis may be challenging, but if we are seeing cats on a regular basis, if we are seeing cats at least once a year for an annual checkup, we may spot early signs of kidney disease, or we may have an opportunity to look for early indicators of kidney disease, a window of opportunity that will allow us to make an early diagnosis, to intervene at an early stage, to help slow down progression and prevent development of some of the complications that we see with kidney disease. So kidney disease is progressive. Over time, it will get gradually worse. The clinical signs become more severe and they become more obvious as time goes by, and cats go through different stages, predefined stages of kidney disease. Based on the results of laboratory testing, we can tell what stage of kidney disease a cat is in. But as they progress from stage 1 through to stage 4, so the signs that they show will become progressively more severe.